Welcome back, everyone. Dr. Russell Blaylock is joining us today. We're going to discuss his book, Natural Strategies for the Cancer Patient. And with cancer rates increasing, this is information you don't want to miss. Welcome, Dr. Blaylock. Thank you so much for coming back and being with us today.
Thank you for joining us, Doctor. It's always a pleasure having you with us. Folks, I'm certain that there are hundreds, potentially 1,000 or more people watching today who has recently been told you have cancer. Is this you? Is this a loved one, a family member? Well, you've turned to the right station today because Dr. Blaylock, not only is he a neurosurgeon, but he's a cancer surgeon. We don't often think of neurosurgeons as cancer, but brain tumors, you've worked on a lot of these, haven't you?
Right.
Yes, it's a very challenging field. And in the last few years of his career, he has dedicated his efforts to natural strategies for the cancer patient. Now, doctor, I think many of us, when we're told we have cancer, immediately we say, perhaps, I'm going to put it in the hands of just the oncologist. I'm just going to do what they tell me, and that's it. Is that a mistake? Is there more we can do?
Well, it's a very large mistake.
Okay.
Because what happened to the oncology world, it's become pure pharmaceutical.
Yeah, it has, isn't it?
And their training program is, well, what regimen of drugs do you use? What's the latest new regimen of cancer-treating drugs? Yet in their own journals, there's just a proliferation of studies on natural ways to control cancer.
Yeah.
And the cancer researchers, the people who's really looking at this, what they're finding is that it's profound. And in many times, it's much more effective than the drugs and will reduce the toxicity of the drugs, make the drugs more effective in many cases, and solve many of the problems that have plagued the oncologists since the very beginning, and that is multi-drug resistance of cancer, the leading cause of cancer chemotherapy failure.
You know, doctor, when we read some of the research on the cancer drugs, the oncologists and the scientists, and God bless them, because they're trying. I'm not upset with them, don't get me wrong, but they get excited over a 2% improvement of tumor shrinkage. I don't want a 2% improvement. I want to be cured.
Right.
Now, I want to get right down to this. I'm a cancer survivor. I'm not going to pull any punches. Are you saying that we should only use natural strategies, that we should ignore chemotherapy? Give us an idea. What are you saying? Do we combine these things? What's the best approach?
Well, it depends on your cancer. Some cancers are showing response of the chemotherapy agent against the cancer. For instance, leukemias, lymphomas, certain type of bone tumors are fairly responsive to it. But what we're finding is if you take the natural substances, these extracts, the curcumin, the quercetin, if you add that to that chemotherapy agent, you get much greater response, tremendous response. And you reduce the toxicity at the same time so that it protects the normal cells and targets only the cancer cell. So your success rate of curing that patient, the goal that you're seeking, is significantly greater. Now, in some other cancers that don't respond to chemotherapy whatsoever, I would say rely only on combinations of the nutrients, because the success against these incurable cancers by chemotherapy, many of them are becoming curable or controllable, or people are living a lot longer, significantly longer. Yet this is being seen worldwide and being ignored by traditional oncologists.
Well, let me ask the question this way. Each cancer is unique, each patient is unique, and they have their own unique needs. So it's hard to say everybody should do this and everybody should do that. But I think for our audience, for the lay people, I mean, this is a tough time to try to learn science when you're sick in bed with cancer.
Right.
Are there some things that really every cancer patient should do? Can we start with the basics? What are the 1, 2, 3s for all cancer patients?
Well, if we look at all cancers, here's the things we know. Most cancers are due to poor nutrition.
Really?
Most authorities agree on that. The percentages they disagree on. Some say 50% of all cancers. That's the most agreed upon number.
Okay.
Some say 70%. Some say 90%. Some say all cancers are nutritional. Okay. Because what we look at, if we look at certain societies where they're isolated and they eat a particular diet, none of them develop cancer.
It's a rare disease in these settings.
If we look at other societies that are completely separate, they eat a similar diet. There's no such thing as cancer. It's extremely rare of any kind.
It used to be that way in this country.
So now it's considered a disease of the Western diet.
Okay.
So when we look in Western countries, we see these enormous rates of cancers of all kinds. Now, we can't ignore that the only difference between these two groups of people is one's eating a diet that leaves certain things out and uses other things, and the other one's consuming things that seem to promote cancer. Well, our science of this has improved so much. Now we know a lot of why there's such a tremendous difference.
Okay.
One is eating omega-6 oils.
Oh.
Omega-6 oils, like corn oil, safflower oil, sunflower oil, peanut oil, canola oil.
The fried food diets.
They are
fast food
powerful
diet. Yes.
cancer stimulators.
Stimulants.
There has been 97 well-done studies demonstrating that it is a potent stimulant for the development and growth and invasion of cancer. When we look at people that have the highest intake of these fats, they have the most aggressive tumors and they're least likely to survive their cancer. This is true for breast cancer, colon cancer, lung cancer, all the major cancers. They grow much faster if you consume. Well, Americans consume 50 times more of these types of fats than we should be.
Now, let's be very clear. These types of fats include the oils that we fry foods in.
Right.
Corn oil, safflower oil, peanut oil, cottonseed oil. Am I getting them right?
Sunflower oil.
Sunflower oil.
Canola oil.
Canola oil.
So the sixes.
This is every day we get this.
All of them have been shown
These
in
sixes.
experimental studies and in human studies to promote massively the growth of cancer.
So
we got to turn that around. Absolutely.
Tell their patients to
Dr.
avoid them.
Blaylock, so I just want everyone at home to understand. Are you saying then we need to balance the six, we need to cut out the six? Do we not need to, we shouldn't use it at all, or we just need to use small amounts? Tell me how much to take, because sixes are in everything we do. They're all around us.
We're consuming 50 times more than we should.
So if we attempt to cut it all out, we're not going to cut it all out, but we're probably going to be okay then.
Yeah, omega-6 oils is an essential oil. We have to have it.
But we're
Our
going to
body
get it
cannot
without knowing
manufacture
it.
But just eating your ordinary foods, you're going to get all the 6 you need. If it's pure food, freshly prepared. It's the processed foods that they're adding these oils to in large amounts. It's hidden. It's in baked goods. It's in your bread. It's in the fried foods you're eating. It's almost in everything that is processed. It's omega-6 fats. Well, why is it there? Because the American Heart Association told it was heart healthy.
Yeah. Okay.
And encouraged people to use corn oil, safflower oil, and sunflower oil instead of saturated fats. Well, saturated fats are not connected to cancer.
Now,
only these fats are, so their recommendation has massively increased cancer in this country. And it also, ironically, increases atherosclerosis and heart disease.
The sixes.
The
I'm so
sixes.
shocked I can't even ask another question.
So the first point is we
amazing.
got to straighten out our fatty acids. Now, before we go to the next big point, there is a special 6 that helps to kill cancer cells, GLA, in borage seed oil. Talk about that. Why is that one so special?
Well, it's because of their chemical structure.
Okay.
You know, what's happening to the omega-6 oil is it's metabolized to produce an immune suppressant and an inflammatory component called PGE2, prostaglandin E2. So when you eat a lot of these oils, you're producing tremendous inflammation in your body, chronically.
Right.
Well, we know virtually all cancer is related to chronic inflammation. This is one of the things we've learned from the $100 billion plus we spent on cancer research, is that inflammation causes cancer. If you take a simple substance added to food called carrageenan, you inject it in an animal, they develop rampant explosive cancer because carrageenan is a powerful inflammatory substance.
Now, let's do this. We're headed to a break here. First point to make on your list, folks, is correct your omegas. Get yourself into balance. Second point is inflammation. We've got to counter the inflammation for the cancer patient. Let's go to the break. We'll return for the rest of the list.